right, good morning, everybody. We have a lot to cover today, so I am going to start us off with some general announcements before we get into the webinar. And as your colleagues and peers are getting here, we'll keep letting them in, and then they'll just get caught up as we get going. So, good morning. This is the Q3 Welcome Baby peer-to-peer, which we have now changed. If you guys didn't notice or if you didn't get the memo, we're changing the title of these. Same webinar, the same rules and everything applies, but we're not calling them peer-to-peers anymore. We're going to be calling them quarterly role webinars. So just be on the lookout for that moving forward. We had some confusion with our other larger peer-to-peer trainings, so we didn't want to confuse everybody. So that's what we're here for today. If that isn't what you thought you were here for, let me know, and we'll make sure we get you to the right training. We have a couple different trainings going on at the same time. So let's let a few more people in. Great. Okay, so you guys know the drill. I think most of you have been to one of these before. If you're a new parent coach or parent coach supervisor, welcome. Please put your name, your role, and your site in the chat. That's going to be our best attendance record. So we pull that chat and make sure that we get everybody's attendance. This is a required webinar for parent coaches and parent coach supervisors. So we want to make sure we give you credit for being here. So do make sure you put your name in the chat for us. Let's see, a couple of general announcements. We ask you keep your cameras on unless you need to step away for some reason, and that may happen, so that's okay. But if you can keep your camera on for the majority of the webinar, that would be great. We have two really great speakers with us today, and they like to be able to talk to faces instead of blank squares. I think we all understand that. So please keep your camera on. Let's see, we are recording the webinar, so if you miss it, if you need to step away, if something happens and you miss part of it, I'll be sending out the recording after like in about a week or so, once it's up on the blog, so that you can access it. And we'll keep it up there. We'll put the slides up there as well, so you can always go back and find that information, pass it along to your colleagues who may have missed today as well. See, okay, if you have questions as we're going, let's put those in the chat, and then Vanessa and I will pull those out and we'll bring them up at the end. That way we do have time for Q&A, so that we'll just keep track of everything, and that way we get everybody's questions answered. And then the final announcement is kind of a fun one. If you have been in the network for a while, or at least a year, you may remember that we do every year an annual summit. It's coming up this year. It'll be in June. And in order to prepare, we are asking that we have you and potentially your other colleagues and maybe even your clients submit some video testimonials describing their experience with the Welcome Baby program, what you like about helping families. I'll put the questions in the chat, why people should sign up. So if you're interested in doing that, I am going to put the link in the chat, and we are really encouraging as many of these as possible. We're going to make a montage of them and show them at the summit. So it could be a really fun way to get your families that you work with highlighted. So put those in there. What we'll ask you to do is you click that link. It will have you record videos for 3 different questions. The questions are here in the chat. So it's what is one way your home visiting program helps families? The second question is, why should families sign up for Welcome Baby during pregnancy? And the third is, what is one thing you always tell your clients about pregnancy, childbirth, or parenting? So you can do these questions yourself. You can encourage your families to do these, maybe not number 3, but the other 2. You don't have to answer every question, but the video prompt will ask you to answer every question. So if you want to skip one, you have to record a short video, but you can just say skip this question for your recording. And then you can record whichever of the 3 or all 3 if you want to. So just a little plug for that. You're going to hear us mention that a lot. So just be on the lookout and hopefully submit one if you're interested. No time limit for the video. They can be as long as or as short as you want. So feel free to stay as much or as little as you want. We'll take anything that we can get at this point. So. All right, any other questions about the summit or just general questions about what we're here to do today before I introduce our speakers and get us started? Okay, great. Well, again, if you have questions as we're going through, feel free to put those in the chat. You can always private message me as well if you have anything that you want to address with me. So without further ado, I am going to go ahead and introduce our speakers, and we'll let them take it away from here. So we are lucky to have two speakers with us today. Hopefully you can see them at the top of your screen. If not, they'll unmute in a minute, and they're waving, so they'll pop up to the top of the screen. But we have Nandita Kapadia with us, and she's a licensed dental hygienist in alternative practice with 10 years of clinical experience working in multi-specialty practices. Her passion for science motivated her to pursue a bachelor's in biological sciences from the University of California, Irvine. Shortly thereafter, she completed her master's of public health degree from Loma Linda University with the vision of working in community health in the future. Finally, she began her dental education at New York University and graduated with a professional dental hygiene license. Nandita is honored to be working with the University of California, Los Angeles as a community oral health liaison, and is focused on providing education and resources to those most in need. And then we have a second speaker. As I mentioned, we're lucky enough to have two today. So Camilo Cedeno has worked in oral health community outreach for over 11 years. As part of Colgate's Palmolive's Bright Smiles, Bright Futures Children's Oral Health Improvement Program, he has helped to bring free dental screenings and oral health education to nearly 1 million children and their families over the span of 10 years. And now, as a part of the UCLA School of Dentistry's Oral Health Collaborative Consortium, he hopes to spread the message of the importance of oral health in LA County, engaging with members of the community from all social and professional backgrounds. So I hope you're as excited as I am to hear from both of our speakers. Please join me in welcoming Nandita and Camilo as they present this webinar on oral health in the perinatal and early childhood periods. Welcome to you both, and thank you for being here.
Wow, thank you so much, Martha, for that introduction. Hello, everyone. Nice to meet you. As Martha mentioned, my name is Nandita Kapadia from UCLA School of Dentistry at the Oral Health Collaborative Consortium. I'll hand it off to my coworker Camilo here if he'd like to introduce himself and say hello.
Yes, thank you, Martha, for that awesome introduction. Hi, everyone. It's nice to be here with you today. I'm Camilo Cedeno, also with the UCLA School of Dentistry and the Oral Health Collaborative Consortium. So without further ado, I'll hand it back to Nandita so we can get started with our presentation today.
Awesome. Thanks, Camilo. So today, my colleague Camilo Cedeno and I will be providing some oral health information as it relates to home visitation. Next slide, please. So first, a bit about our program. We are the Oral Health Collaborative Consortium, or the OHCC. We are funded by the Los Angeles County Department of Public Health's Oral Health Program in partnership with UCLA School of Dentistry, our program director being Dr. Hung-Hoo Liu. So our program is actually funded by Prop 56, the funds in Prop 56, the tobacco tax. So the county has funded our program and hired UCLA, basically has hired us to be community oral health liaisons. And you'll learn a little bit more about our coverage areas and things of that nature. Next slide, please. So our program's main goal is to implement the county's Community Oral Health Improvement Plan. This is a strategic plan, which you'll see in the next slide. It has 6 main objectives. The OHCC supports all of these objectives. We have activities in our scope of work that kind of touch each of those 6 objectives, but we have special focus in oral health education for children living in underserved communities throughout Los Angeles. Next slide, please. So the OHCC is a countywide program. We have 4 oral health liaisons, each liaison covering 2 spas or 1 mega spa. So Mega Spa 1 covers Spa 1 and 2, which is San Fernando and Antelope Valley. Mega Spa 2 covers Spa 3 and 4, San Gabriel Valley and Metro. Mega Spa 3, which covers Spa 5 and 6, West and South LA. And lastly, Mega Spa 4, which covers Spa 7 and 8, East LA and South Bay. So we are providing materials and linking various community partners all the way from Palmdale and Lancaster, all the way down to Long Beach. So we are currently looking for oral health liaison for Megaspa 1. So if anybody knows anyone that's interested in working in public health, they don't necessarily need to have dental background. We have a large coverage area that at this time doesn't have a liaison. So that's just a little bit about our program. Before we get into the presentation, I just wanted to hand it off to Martha. We wanted to do a quick pre-test. I think it's going to be on Mentimeter, just to kind of gauge understanding of the topic matter about oral health and dentistry. We will do a post-test at the end. It's just a couple of questions from what I remember. So if I can hand it off to Martha, and then we can get started with the actual content.
Okay, great. So I think all of you have probably used Mentimeter before, but I'll walk you through it if you haven't. So let's put up these questions. All right, so if you go to www.menti.com, you can do it on your phone or on your browser, whatever works best for you. It will ask you to use a code, to put in a code, and the code is 22454261. It's up at the top of the screen there. 22454261. Cool, somebody figured it out, so great. So then it will ask you to answer these questions, and as I'll keep moving through them, it will change on your phone. But the first question that we have here is, when thinking about health topics, how likely is it that you will bring up oral health with your families? And you've got a scale there, I think, from 1 to 5. And so as your colleagues are entering, you'll see that little slider will move depending. So this number represents the average of the responses we've had come in so far. So I will give everybody a couple seconds to get that lined up, and we'll move to the next slide shortly. Vanessa, if you can't read the code at the top, Vanessa has put it in the chat for you. Okay, I'm going to close this question and move on to the next one in about 10 seconds. It looks like we're at about 4.3 out of 5 for likelihood of bringing up oral health. Next question, when thinking of health priorities, how important is it to care for your teeth? Not important to very important. Again, a sliding scale. Sorry, I think the voting was closed. Now it's open for you. All right, I'm going to move to the next slide. So we're at a 4.7 out of 5 for important. This is great because it gives our speakers a good chance to understand where everybody's coming from, the starting point. So that's really helpful. All right, as of now, how easily can you access the proper materials to easily educate your families about oral health? How easy is that? Not easily or very easily? Again, a sliding scale. Okay, I'm going to switch to the next one where it looks like we're right about in the middle there. So hopefully today's information will help. As of now, how important is oral health during a pregnancy? Not important or very important? Again, a scale there, 1 to 5. Okay, excellent. Moving on. Looks like everybody recognizes the importance. That's great. As of now, how confident are you in showing your families how to care for their baby's new teeth? Not confident to very confident. Okay, it looks like we're at about 4 out of 5 there. Okay, when thinking about health topics, oh, I think we did this one already, so that brings us back to the, we did this one already. Okay, sorry, one second, make sure I got them all through here. Yeah, okay, great. So we got all of our questions there. So hopefully that gives Nandita and Camilo a little chance to see where we are in the room. Thanks everybody for participation. We'll go through those again at the end to see what may have changed throughout the course of today.
Great, thank you guys so much for doing that. It just helps us kind of understand and gauge the impact of the presentation as well. So we'll just kind of go back to the next slide. We'll get started here in just a minute. Perfect. Okay, so what is oral health? Oral health is multifaceted and it includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence, with comfort. And according to the World Health Organization, oral health is actually a key indicator of overall health and well-being, as well as quality of life. Being a dental hygienist, I worked in the clinic for over 10 years, and I can really, from experience say that the mouth is a window into the health of your body. There are several systemic, diseases and systemic ailments that present first in the mouth. And so it's really important, for us. I mean, one of our main goals with this presentation is to instill that mouth-body connection, or that the importance of oral health and how it's related to the rest of the body. Next slide, please. So oral disease can spread or increase the risk of bacterial infection, fungal infection, and other diseases. So as you can see on the slide here, various diseases are related to gum disease, for example. To highlight a few, diabetes is related to oral health in that the more uncontrolled the diabetes is, the more aggressive the oral disease will be, and vice versa. Same thing for heart disease. It's actually been found that bacteria that infect the teeth and the gums infect the heart as well. So that same plaque and bacteria that's found in the mouth is the same plaque and bacteria that's found in those patients that are suffering from any form of heart disease, but usually the more severe form. So again, we just want to stress the importance of oral health, as many people are unaware, between the connection of our mouth and the rest of our bodies. Next slide, please. So just to switch gears here, we want to shed light on baby teeth and primary teeth. Healthy primary baby teeth are important. There's, some demystifying, there are some myths out there, especially in our underserved communities, that, baby teeth are going to fall out anyways. Why do we have to take care of them? There are several reasons why healthy baby teeth are important. So they assist in speech development. Healthy baby teeth improve appearance and build self-confidence through a beautiful smile, fosters good nutrition through proper chewing, and the main thing clinically is that they act as a space maintainer in the jaw required for proper development of permanent adult teeth. And when primary teeth are cared for by brushing twice a day, and we usually recommend that children, we want to help children out by brushing and flossing up until the age of 8 or 9. So yes, we do want them to independently brush teeth and floss, but a lot of times there needs to be a guardian there, just kind of helping them and making sure that they're brushing thoroughly and effectively. So when primary teeth are cared for by brushing twice a day, it enables a child to pay attention and learn in school without any dental pain. Our team currently is actually working with several elementary schools to provide screenings. We're working with the team at UCLA. We provide the educational resources, and the clinical team provides the actual screenings. And that's the one thing that we've learned in schools, is that a lot of kids are sometimes misbehaving, or acting out, missing school, and a lot of times it's hard to pinpoint what that is, and it comes from dental pain in the mouth. It's hard for them to express what's happening, especially like at a kindergarten level, first grade level, when, you know, there's primary teeth there's some permanent teeth coming in. So overall, primary teeth are really important. I know they fall out, but we want to make sure that we're brushing and fostering those great habits and relationships. Next slide, please. So I'd like to review some stats that affect children in California, just mentioning about our elementary school activities, and basically their risk for cavities, especially for those families who are in underserved areas. So some of the statistics is that, you know, overall dental cavities or caries remain a common and significant problem. 54% of California children have caries. So that's over half, you know, that's way over the percentage where it should be. And by kindergarten. So kindergarten's like 5 or 6 years old. And 28% have untreated decay and 19% have extensive decay. And again, that is something that we're seeing currently in the schools. Children, even at the kindergarten grade level, it's actually a younger grade level to be doing screenings at. And they know, they're afraid to have a screening done because, especially if they're at that 19% and have extensive decay, they know, they feel the pain in the mouth. They probably at that point have had some type of dental experience, good or bad. It's, you know, it's uncertain, but you know, it is something that we really like to educate on, that it's important. The prevention measures and things are important so that we can kind of reduce some of these statistics. So over 70% of California children have caries experienced by 3rd grade. And there is a oral health disparity by income and race ethnicities as well. So ultimately, early intervention and disease recognition is key for these children, and it's very, very important. So we'll go on to the next slide here. So just to take a step back and discuss what causes tooth decay so that we can consider ways to prevent it. Tooth decay is a multi-step process that results in destruction of tooth structure. The bacteria in the mouth, from the sugars that we eat in our diet, from the carbohydrates that we eat in our diet, are converted to acid. And that acid takes away the minerals in the tooth enamel. And if the cycle of acid production and demineralization continues, the enamel will weaken and break down into a cavity. That's the actual hole in the tooth. So this is kind of that cycle of acid production causing tooth decay. Now, not all sugars are bad, but the things to avoid or limit are sugary foods and drinks, beverages. There are several beverages, sodas, energy drinks, even sports drinks, Gatorades, and a lot of those sports drinks that are kind of marketed as like healthy, somewhat healthy, they're highly acidic and full of tons of sugar. So beverages are a big source of sugar that kind of sometimes doesn't compute. And sticky foods are another thing we want to avoid, especially for our children. So you can see on the slide here, one of the things that we train on is we want, you know, parents and caregivers and other community partners that are working with children, pediatricians, things like that, to lift the lip and look underneath, you know, the gum area and the lip area. And you will see sometimes that there's these cavitations or cavities, and a lot of times that's decay. That's a sign of decay that needs to be addressed. And so this is a couple of photos of that on that slide here. Next slide, please. So tooth decay is a disease called early childhood caries. It's a chronic infectious process that destroys tooth structure, leading to loss of chewing function, pain, and infection in children up to 5 years of age. ECC was once known as baby bottle tooth decay, as typically upper front teeth are least protected and usually the first to be affected by tooth decay. So you'll see these photos on the left. They are on the slide. They are examples of early childhood caries or baby bottle tooth decay as it was once known. So you can kind of see here, you know, when we are leaving milk or formula, breast milk, any form of, you know, really, whether it's regular milk, breast milk, or formula in a bottle overnight, putting the baby to sleep in that way, that milk just sits on those teeth, and there's a lot of sugar in all of those kinds of milks. will eat away, like I mentioned, like I was going through the process in the last slide, eat away at that enamel and cause this kind of decay. So on the slide here, it's pretty gross decay. This child will likely, I think it's two different children, the top photo and the bottom photo, that's what it looks like to me, likely will need extensive treatment, crowns on those teeth. I see some permanent teeth in the back that are also have large cavities in them. So really, really important that we make sure that we're not, leaving milk overnight for the for our babies that are still utilizing a bottle, weaning the child off the bottle at the appropriate age. Water is the best beverage. That's what we recommend. And if there is juices and things like that, we want to do those at mealtime and dilute those the best that we can and make sure to brush afterwards. Next slide, please. So to switch gears here, I just want to talk a little bit about tongue tie. So if you ever looked in the mirror and looked under your tongue, you would see that your tongue is attached to the floor of the mouth or of your mouth. So this attachment is a web of tissue called the lingual frenulum. And in cases where, mostly in children, where there's a tongue tie, or the scientific or clinical name is ankyloglossia, there is an inborn variation in this attachment. So that lingual frenulum may thicken or shorten, restrict the movement of the tongue, or it may tether the tongue too close to the lip. And tongue tie may affect an infant's ability to latch effectively during breastfeeding and can cause maternal symptoms as well during breastfeeding. Rarely, though, does tongue tie cause mechanical difficulties in the child's speech or oral hygiene. So in terms of diagnosing tongue tie, typically that's done at the hospital. We always, educate our pregnant patients that you want to look for it yourself and bring it up to the pediatrician while you're in the hospital right after delivery, because it's usually in the first few weeks that you will, find out that infant has a tongue tie. But in terms of diagnosis, tongue tie may be suspected in infants or children who have difficulty with the following. So breastfeeding, lifting their tongue, sticking their tongue out. The tongue may appear notched or heart-shaped when the child attempts to do so. Moving the tongue from side to side, and licking their lips or sweeping food debris from their teeth. So this is kind of, just a few things to kind of keep in mind when speaking with some of our families, is that if they are seeing these things, then to really reach out to their pediatrician, have them, the pediatrician will typically refer to a pediatric dentist. Sometimes you can reach out directly to the pediatric dentist. It just depends on that patient's primary care and things like that. So in the next slide, we'll discuss some of the surgical treatment options available for tongue tie. So in terms of treatment, if the main complaint is difficulty with breastfeeding, usually a lactation consultant or infant feeding expert can help assess breastfeeding and then provide non-surgical interventions. But there are some surgical procedures that can be done. So there's two here that I'd like to highlight. So the first is a frenotomy. And then the second is a frenuloplasty. So the frenotomy is more common. It's a surgical procedure to release the frenulum that I discussed in the last slide, so that the tongue can basically move more freely. This is the most common. Fortunately, I've never seen this in clinical practice, but I have a lot of girlfriends that are having babies and have a few that have dealt with this, and several of them have had this done. So it's very, very common. And usually the babies can feed almost immediately after. Nowadays in the dental offices, we're utilizing lasers versus like a blade, like a scalpel. So when you're utilizing a laser, the recovery time is much faster. And then when there's more complicated cases, a frenuloplasty is done for more complex cases of tongue tie, for revision procedures, and it involves plastic surgery to the frenulum, speech therapy, tongue exercises, also may be a part of the recovery process. And so this is, I think, when there's something else going on, typically we're doing something more invasive called the frenuloplasty. But just some ideas on the treatment options that are available to our infants and families that are experiencing tongue tie. So we'll go on to the next slide here. So we talked about tooth decay. Now we want to talk about how we can prevent that. Recommendations on fluoride toothpaste should actually begin as soon as the teeth erupt. So what we recommend, two things. We recommend that the child sees the dentist on the site of the first eruption of the tooth or before their first birthday. Typically, these appointments with the dentist are very quick and easy and not, they're not doing very much if there's a very small tooth that's erupting, or even by their first birthday if they have a few teeth, just getting them used to the process. And same thing with fluoridated toothpaste. We emphasize age-appropriate toothbrushes, using them twice a day with the appropriate toothpaste amounts. So as you can see on the slide here, we recommend children under 3 use a smear or a rice grain size of toothpaste, and children 3 and older, and even until our age, use a pea-sized amount of fluoride. So just remember, there is such a thing as too much toothpaste, which is no longer effective. So a lot of marketing and commercials, you'll see that big line of toothpaste that they put on the toothbrush. It's actually not necessary. You don't really need that much toothpaste. Half of it falls in the sink. Just a pea-sized amount for our 3 and older is sufficient. And we always recommend a fluoridated toothpaste, even for those children that are under the age of 3. We just have to reduce the amount of toothpaste. At a smear or a rice grain amount of toothpaste for a child that's less than 3 years old, if they swallow it, it's not at a toxic level. It's okay. Sometimes, children will eat the toothpaste, but it's still getting them in that habit and instilling those proper oral hygiene habits. Next slide, please. So another preventative measure is flossing. So for children, flossing with traditional floss can be challenging and frustrating and time consuming. It's sometimes very time consuming for the parents or caregivers. So our recommendation is our flossers, just like the ones shown on this slide. It's a great tool for kids. It can kind of make it fun. It's smaller and easier for mouths, and it promotes healthy habits on the go. So, I sometimes will floss anywhere that I can on the way to work. When I do go into campus, and I floss, in front of the TV and things like that. So, wherever we can kind of get in those oral hygiene habits, and however we can make it easier and fun, especially for children, even for adults. I used to recommend these to my patients that would not floss at all. I mean, traditional floss is usually the best for adults. But if we're not flossing at all and we utilize these flossers, it's better than nothing. So, and for kids, absolutely, this is a really great tool to, on top of brushing and flossing, utilizing fluoridated toothpaste, to utilize these flossers as well. Next slide, please. So lastly, we just want to give teeth a chance by snacking smart. So we want to discuss with our caregivers how we can choose healthy snacks. We want to avoid sugar-containing snacks and drinks, avoid sticky snacks and foods, including raisins and dried fruit. Dried fruit is like a very common healthy snack, but it's full of sugar. It's very, very sticky. So, if we can utilize those as sometimes snacks, that's something that we like to train on. We want to avoid very starchy snacks, avoiding sodas, even diet sodas. There's lots of acid in the carbonation. With teeth and oral health, it's not just the sugar, it's the acidity as well. So, if there are things like soda, energy drinks, the sports drinks, they're high in acid, and that acid, like I mentioned earlier in earlier slides, that acid will break down the tooth enamel. So juices for our children, juices are a big, kind of beverage that's consumed. And so we actually recommend limiting juices to 4 to 6 ounces a day. And ideally, juices should only be given at meal times. And we recommend diluting the juice if possible. But overall, just picking healthy choices and, water, fresh fruits, nuts, string cheese. Cheese is a really good snack for our little ones. And, if we do indulge in some of these sometimes snacks, making sure to brush and floss, making sure that child is being helped out until the age of 8 or 9 is important and necessary. So we'll go to the next slide here. I'm going to hand it off to my colleague, Camilo. He's going to go into a different topic here. Thank you guys so much for your attention. I'll just hand it off to you, Camilo.
Thank you, Nandita. And thanks again, everyone, for being here with us today. So we're going to go on and talk a little bit about pregnancy during oral health and some different tips that you can share with the various pregnant women that you're visiting with in your home visiting adventures. So if we can go on to the next slide, please. One resource before I start covering these statistics that I'd like to share with you all is the Smiles for Life curriculum, Smiles for Life, oralhealth.org. I'm going to put that into the chat if you're interested in learning a little bit more in detail about this particular topic. This is a great resource where you can go through the different modules that are available. There's modules on oral health, there's modules for children, for adults, for pregnancy. So you can learn as much as you want about this topic through this free resource. Putting it in the chat right now. There it is. So let's talk about the dental disconnect during pregnancy. This is a big issue. Recent studies show that only 26 to 34% of all pregnant women visit the dentist. I would more so, just to answer the question really quickly that popped up in the chat, would we recommend this resource for clients? This is a resource I would recommend more so to home visitors or individuals providing education to clients, children, parents, about oral health. So it's definitely more of like a train the trainer type of a resource. So moving on, you can see here, based on the statistics that we're sharing, that not a lot of pregnant women visit the dentist. And this is an issue because many of you might know that, may or may not know that pregnant women can be at greater risk for certain dental health related issues, which we'll talk about a little bit more. But just to go through some of these statistics, 26 to 30% of all pregnant women only visit the dentist. And that percentage is even lower when you're talking about Hispanic women, women in lower socioeconomic status, and those that are not aware of oral systemic linkages, meaning that, like Nandita mentioned earlier today, our oral health is linked to the health of our entire bodies. Everything that goes in through the mouth affects the entire body, right? And if we allow an overgrowth and a disbalance of bacteria affecting our oral health in our mouth, and that can certainly have negative effects on our overall health, but also particularly for pregnant women. So that's something that we definitely want to educate on. And you can even see here that even women who present dental problems, meaning pain, discomfort from tooth decay or other dental problems, only half of those women visit the dentist. And this is due to a disproportionate amount of disinformation and fear around visiting the dentist during pregnancy. And it's something that we want to dispel. We'll share with you a few tips in terms of encouraging pregnant women to visit the dentist throughout the course of their pregnancy, to let them know that it is safe. And again, even amongst women with dental insurance, you can see that there's a great decline of dental care during pregnancy. So again, something we need to put a little bit of emphasis on when we're speaking to our pregnant women. I'm sure many of you have encountered cases where the pregnant women that you're visiting with might be afraid to go to the dentist. So definitely a topic we want to bring up with them. Next slide, please. So here's a couple of different coaching tips about letting women, pregnant women, know about the importance of visiting the dentist during pregnancy. First of all, dental care is safe and important during pregnancy, and it's important to encourage your clients to seek routine dental care as well as, if needed, emergency dental care at any stage during the pregnancy. Poor oral health during pregnancy can lead to poor health outcomes for both mom and the baby, potential preterm birth, abnormalities in baby's teeth. Certain medications that are taken during pregnancy can impact the formation of baby's teeth. So that's also something we want to encourage pregnant women to check with their doctors about that specifically, and any side effects that might be caused by those medications and in the development of that child's teeth. Children are more than three times as likely to have tooth decay if their mothers have high levels of untreated tooth decay themselves. And untreated gum disease in women can harm their systemic health, like we've mentioned. It can lead to low birth weights or preterm births, like I've already mentioned. And oral health is definitely a transmissible disease. Oral health is caused, like Nandita mentioned, by the bacteria that builds up inside of our mouths, and this balance of bacteria that builds up inside of our mouths, causing eventual tooth decay, which can certainly be passed on from a mother or from a caretaker to the child, again, increasing the risk of having tooth decay as they develop and grow. So something to watch out for. Next slide, please. So the American Congress of Obstetricians and Gynecologists agrees that procedures like cavity fillings and crowns are safe and important to have during pregnancy to prevent potential infection. You want to make sure that pregnant women are scheduling any dental work. The second semester is typically the second trimester. I'm sorry, is typically the best time to schedule any preventative or restorative dental work. Along with that, we want to encourage positive and consistent oral health habits, really encouraging brushing twice a day after breakfast and before bedtime, and flossing once a day. Pregnant women are particularly at higher risk for gingivitis due to the overgrowth of bacteria that can happen. That's naturally caused during pregnancy, actually. So this is something that we want to highlight in the context of maintaining great oral health habits and also watching sugar intake. And again, continuing to visit the dentist every 6 months. We should mention that according to the American Congress of Obstetricians and Gynecologists, they also agree that all cosmetic dental work, meaning nothing that is medically necessary, should wait until after the baby is born as well. Next slide, please. So here are some of those treatment tips. We mentioned that if the client, pregnant woman that you're working with in particular, needs to visit the dentist during that first trimester, care should begin early, especially if extensive care is needed. Scheduling visits in the afternoon to help avoid morning sickness, that's a good way to help keep the patient comfortable. Morning sickness can obviously be a barrier to receiving dental care. If you're at the dental office in the morning and you have your mouth open and you're experiencing nausea and morning sickness, obviously that can be very uncomfortable for anyone. So afternoon visits are a good way to avoid that. During the second trimester, this is the ideal time for dental care. It's typically when the pregnant belly is at a manageable size to where it's still somewhat comfortable to lay back in the dental chair. And also it's the time during the pregnancy where some of the key developments have already happened in the fetus, and can make it a little bit more manageable in terms of receiving more invasive cares. I'll share some more statistics with you before moving on to these different points. 20% of all pregnancies end in miscarriage, and 80% of those miscarriages occur in the first trimester. There's no association between dental procedures and the incidence of miscarriage, but despite this fact, elective treatments are often delayed during the first trimester because of fear that dental procedures will be associated with those miscarriages. Although those miscarriages typically can occur spontaneously or due to other health issues. Women should not be prevented from receiving needed dental care based on unfounded fears. So these fears about miscarriage being linked to dental care are completely unfounded. This is according to reputable sources that will, we've shared the presentation with the organization, and you're welcome to look through some of those as well. But essentially, during the second trimester, the fetus is not large, like I mentioned. It makes it a little easier to recline in the dental chair. But when you're talking to your clients, you may encounter some of those fears, but we encourage you to really emphasize that these fears are unfounded and that they should be able to go out and seek dental care at any time during their pregnancy. During the third trimester, late in term, it's obviously a little more difficult to lay back because at this time the pregnancy is at full term, and the belly's typically large at this time. So generally, we try to position women on the left side with a towel prop to just make it more comfortable, encouraging the patient to stand and walk periodically during long dental appointments can help to ease some of that discomfort, and also elevating the head to help avoid any kind of shortness of breath. Because obviously all of the abdominal contents during the pregnancy are being pushed up and potentially compressing the lungs while they're laying back in the position that they're receiving dental care. So elevating the head is a tip that you can provide your pregnant women with, and to be more comfortable in the dental office. And we want to share these things in a way that we can encourage or pregnant women to have those conversations with their dental provider. You want them to be comfortable, to be able to speak up to their dental provider and receive the needed dental care. We just got a question in the chat talking about x-rays and how we should handle fears around x-rays. And one thing that I will share is that x-rays are completely safe during pregnancy. You need x-rays to be able to diagnose a dental condition. It's an absolute must in terms of being able to diagnose cavities or any other dental conditions that can't be seen by the naked eye. And the amount of radiation that is emitted during a dental x-ray can't even be measured by conventional measuring sources. So this is a very tiny quantity that will not affect the health of the patient or the baby. So that's another, again, unfounded fear that we can address directly. Thank you for that question. The one other thing that I'll mention is breastfeeding. We want to promote breastfeeding as much as we can. Breastfed children are less likely to develop caries, and the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months of life, continuing until at least the age of 12 months for that baby. Next slide, please. So we want to prepare our pregnant women to, expect some of the different things that can happen with teeth during pregnancy, right? I mentioned that there's changes in teeth or gums. There's pregnancy-induced gingivitis, and that's something that, again, we have to watch out for with our pregnant women to make sure that they're maintaining good oral hygiene, because there is going to be a disproportionate imbalance of bacteria taking place in the mouth during that pregnancy potentially. So again, just maintaining oral hygiene practices, brushing twice a day, more often as possible, flossing, and using fluoridated water. We're very lucky in Los Angeles County to enjoy fluoride in our tap water. Many people don't drink it because generally the taste of tap water isn't the greatest, right? So what we can recommend is, for example, using a Brita filter, which will not remove the amount of fluoride that's contained, or it doesn't have to be Brita, it can be any brand, but that will not remove the amount of fluoride that's contained in that tap water, and it'll help to improve it. Also, cooking with tap water can help to make sure that pregnant women and our families in general are receiving a good amount of fluoride in their regular diets. Also, using over-the-counter fluoride products, like we mentioned, we recommend fluoride toothpaste. Generally, fluoride toothpaste is going to be, better than any other toothpaste, regardless of the brand, at helping to prevent cavities and helping to maintain a good balance of bacteria in the mouth. And also, making sure that we're counseling on healthy eating practices. Overeating can be very common during pregnancy. Eating of, lots of sweets and junk foods can be very common during pregnancy. So that's something that we want to try to coach on, which I'm sure you guys already do, to make sure that our mothers and the babies that are developing inside of them stay healthy. Next slide, please. And I just want to call attention again to one of the questions that we found in the chat, where one of the particular providers mentioned that they've had mothers tell them that their dentist told them to return once they've already delivered. So there are some dentists, unfortunately, out there that are still fearful of treating pregnant women and may even discourage receiving dental treatment during pregnancy. Again, like I've mentioned, this is all based on unfounded fears and outdated information. So I would encourage those particular patients to seek out a dental provider who, if not that one that they typically go to, isn't willing to treat them during pregnancy, to seek one out that will provide them that treatment, because it is essential for the health of that particular.
Yeah, just to add on to that, Camilo, it's common there. We unfortunately live in a very litigious society, and so that's a lot of the fear. With on the dental side, working in a dental clinic, I worked in two types of offices. One office that will absolutely not see a dental patient, a patient who's pregnant, sorry, not a dental patient, a pregnant patient. And so, you know, I worked with a dentist that was like very, you know, like very much like, oh, we have to see them, you know, like it's really important. So, you know, one other recommendation I can make is you can encourage your mothers and pregnant people to see their primary care physician, get a medical release. You know, the dentist and the dental office is going to go off of the medical opinion, right? So if we're not sure about something, we will get a medical release and say, hey, like for some other ailment, right? If it's not pregnancy. And so, you know, if they come back with a medical release in their hand, say they can't find another provider, you know, or they don't want to switch to another dentist because that can be challenging. They want to see the same dentist. If you have a medical release in your hand, it's really hard for them to deny you services.
Hey, Nandita, I'm so sorry, you guys. I got to go grab my laptop charger. Can you cover this slide for me? I'll be right.
Oh yeah, sure. So just to finish off what I was saying, yeah. So that medical release is huge for pregnant patients if they are being denied services. But yes, on the dental side, being, you know, sometimes dentists are just fearful of treating somebody that has any kind of anything other medical going on because you know, with a fear of being sued, unfortunately. Okay, so in addition to that, answering that question, I'll just cover this slide until Camilo comes back. So some of the questions that we can ask our pregnant or postpartum individuals is, you know, how often they're brushing their teeth and if they utilize fluoridated toothpaste or mouthwash. You know, if they have had any, you know, gum problems or teeth problems. I don't know if Camilo covered this, but there is something called pregnancy-induced gingivitis. You know, when we're pregnant, there's lots of different hormones going on, and those affect the gums and the teeth. And so typically when there is pregnancy-induced gingivitis, it's hormonally charged. And so once kind of those hormones come down, whether after delivery or even sometimes throughout the delivery, the gum tissue will kind of come down and go away. But those preventative measures are still super important because while that patient is experiencing that type of gingivitis, you know, it can really cause distraction if they're not brushing and flossing. Are you good, Camilo? Can I hand it off back to you?
Yes. Okay, thank you.
Great.
Sorry about that, everyone. You know, can't live without being tethered to the power. So anyways, so thank you, Nandita, for covering about pregnancy-induced gingivitis. One of the recommendations for this is chlorhexidine rinses. This is something that can be prescribed by your dentist and is something that can help to reduce the amount of excess bacteria that's caused by those hormonal changes. But these are just general interview questions that can help you guide conversations around maintaining oral health. I'm sure a lot of you are familiar with something that's called a motivational interviewing. So these questions are a great way to ask your clients about their habits and to help to highlight maybe some of the inconsistencies that might be there in terms of them helping them to maintain their good oral health, but those inconsistencies that a lot of you know, people can have in terms of their way of thinking about oral health or the way that they approach those oral health habits. And then you can, you know, then turn around and be able to provide the correct information and encourage those positive habits to help them make those changes, those behavioral changes on their own. So here are some of the different questions. Since becoming pregnant, have you had morning sickness? How often are you vomiting, if that's the case? What are you doing to help to, you know, take care of your oral health after that happens? After your baby's born, how can you help protect your baby's teeth from tooth decay? This is a great way, obviously, of assessing how much they know about oral health around, you know, their infant's oral health and how to help maintain it. And again, just asking them whether they have any questions or concerns about getting healthcare while they're pregnant or after their baby's born is a great way of finding out what their current oral health status is, when was the last time they went to the dentist, and then being able to encourage them to hopefully visit the dentist either during their pregnancy and again after the pregnancy is over as well, just to maintain that follow-up. Next slide, please. So here are a few of the interventions that we can recommend in terms of maintaining good oral health after the baby's born. When it comes to childcare, making sure that the child is not put to bed with a bottle. This is something extremely common. And we want to avoid, especially putting a child to bed with a bottle that contains either milk or juice or any liquid that contains sugar. Water, as we all might know, is the best drink for our teeth. It contains no sugar. It doesn't cause any cavities. And if we do provide a bottle to the child, that will be the best alternative. But again, ensuring that they don't go to bed with the bottle can be a great way of just preventing that initial baby bottle tooth decay or early childhood caries that Nandita discussed earlier. Cleaning the infant's teeth with a smear of toothpaste daily after the teeth erupt. Prior to the teeth erupting, we should definitely recommend also to clean the gums and remove any debris from the mouth. You can do so with a damp washcloth, just to make sure that there's no milk and no sugars and no food left behind inside the child's mouth, as that can affect the health of the teeth that are coming in, even though they have not necessarily erupted yet. We want to try to maintain the level of bacteria inside the child's mouth as balanced as possible. Also, recommending that the child sees a dentist within at the age of 12 months or when that first tooth appears. Like Nandita mentioned, this is a great way of getting the child used to visiting the dentist. It's typically a very quick appointment, but it's also a great way to catch anything that might be happening early on to just make sure that that child is in the best road possible to having good oral health and hopefully not having to have too many invasive treatments early in age, which can also cause fear of the dentist later on in life. So taking the child to the dentist early on not only helps them get used to it, but just make sure that their mouths are healthy throughout their entire development process. Again, promoting breastfeeding. Breastfed children are less likely to develop caries, like I mentioned earlier. And also, I mentioned the chlorhexidine rinse for mothers. And also xylitol gum is another way to help regulate the amount of cavity-causing bacteria in the mouth. Again, this is for pregnant mothers. Particularly, this is, again, just a good way to help keep a balance of healthy bacteria in the mouth, especially when we're not able to brush or we're out and about after meals. Xylitol gum, even just for anyone, the xylitol has been shown to help reduce the amount of plaque that builds up in the teeth, and chewing gum in general, particularly a sugar-free gum, can help to remove debris from the teeth that may be stuck, and again, just helping to keep a healthy mouth. Next slide, please. So now we have some resources to share with you all. These are going to be some additional resources that can help you guide conversations about oral health, both with pregnant mothers and also during that postpartum stage, to help guide parents with how to take care of their children's teeth. Next slide, please. So here we have the Los Angeles County's Department of Public Health child oral health education resource. It's called Love Your Baby's Teeth. There's some great videos that are fun for both parents and kids to watch that can help them learn on how to take care of their teeth. And it's just a great resource, a great educational resource, excuse me, that educates on how to care for your baby's teeth throughout all of the stages of life. If we go on to the next slide, we'll be able to see a little bit more about that. You can see that there's tips during pregnancy from 0 to 6 months. And like I said, it goes all the way through the time that the child reaches the age of a teenager. And actually, I should mention, here's a good place to talk about teething. During 0 to 6 months, during that first year, teething can be common, right? And discomfort in the child from teething can cause a lot of havoc and can make it difficult for that child to sleep or for that child to eat, for the mother to be able to provide breastfeeding. So the Mayo Clinic actually has several great recommendations for dealing with pain and discomfort from teething. First, we'll cover some of the classic signs and symptoms from teething: drooling, chewing on solid objects, irritability, crankiness, sore, tender gums. One of the things that A couple of the different natural ways that are recommended to help ease the discomfort for teething are by rubbing the baby's gums, using a clean finger or moistened gauze pad to rub the baby's gum. The pressure can ease that discomfort. Also, providing cool relief by either using a cold washcloth, a cold spoon, teething rings that are chilled, particularly the solid teething rings, as the ones that are filled with liquids can pop inside the baby's mouth from pressure. So we typically recommend those solid teething rings. Don't give your baby a frozen teething ring. However, because the contact with extreme cold can be harmful. So we want to be careful with, how cold what we're providing is to that child. Offering a teething ring, like I said, try one made of firm rubber to avoid the liquid fill variety, from breaking inside of the child's mouth. Also, if bottles seem to work, you can fill it with water. However, again, not putting the baby to bed with that bottle or avoiding prolonged contact with any liquid that might have sugar, because that can cause tooth decay. And then also trying hard foods. If your baby is eating, if your client's babies are eating solid foods, you might want to offer something edible, such as peeled and chilled cucumber or carrot. However, keeping a close eye on the child to avoid any pieces that might break off and that could potentially pose a choking hazard. And then there's a lot of drooling during teething, like I mentioned. So to prevent skin irritation, we want to educate our parents that, we need to be wiping the drool frequently. Keeping a clean cloth handy can be a good way to just making sure that baby's chin is dry. And potentially, if skin irritation does become an issue, applying a moisturizer such as a water-based cream or lotion. And if none of those things are effective, trying an over-the-counter remedy such as acetaminophen or ibuprofen for children, this might help. Also, though, just being careful with trying these medications, encouraging the parents to consult with their doctor, and also avoiding teething medications that contain benzocaine. Benzocaine products have been associated with methemoglobinemia. Sorry, I'm having a hard time pronouncing that one, but it's a rare serious condition that reduces the amount of oxygen in the blood. So medications with benzocaine for teething, that's something that we want to make sure that we educate our parents to avoid, and again, to consult with their doctors. But again, going back to Love Your Baby's Teeth, it's a great resource to help teach your parents about, or your clients about, caring for their children's teeth. Next slide, please. And along with the Love Your Baby's Teeth campaign, there's a social media toolkit. We can share this with you. You can use it to, if you reach your clients through social media regularly. This is a great way to make sure that they're seeing these messages on somewhat of a regular basis. They're available in various languages, and particularly in English and Spanish. So again, just another great resource to help provide that much needed oral health education for parents, for brand new parents. Next slide, please. Another topic that we want to talk about is medical coverage during pregnancy. So here in California, Medi-Cal actually increases coverage during pregnancy. And we want to, again, make it easy for pregnant women to visit the dentist and encourage them to do so on a regular basis. So these are resources that are available through the Smile California website, smilecalifornia.org, where you can learn about the coverages that are provided through Medi-Cal, and particularly during pregnancy, knowing that there is increased coverage for pregnant women to be able to visit the dentist, and actually that income threshold for Medi-Cal during pregnancy increases as well, making it available to more pregnant women, to more women typically, rather than when they're not during pregnant, rather when they're not in that pregnant stage. So next slide, please. To talk a little bit more about that, for those community members or pregnant patients who do not have full scope Medi-Cal, or have restricted Medi-Cal, it's important to, again, educate them that they do have dental benefits through Medi-Cal during pregnancy. For example, when seeking care, they can work with the office manager or treatment coordinator in their dental office to receive a pre-authorization for treatment, making sure that when billing the insurance, that it's mentioned that that particular patient is pregnant or in the postpartum stage. So this is just another way to help educate on how they can receive, how your clients can receive additional dental care during their pregnancy, and they can receive that coverage through Medi-Cal. Next slide, please.
For the previous slide is, Camilo had mentioned about x-rays. And so for those patients who have Medi-Cal, whether it's full scope or restricted, x-rays are absolutely a must for them to, for the office to be able to bill services and be paid for that, which indirectly will allow them to see that patient then. So really, really important that the information that Camilo provided earlier, x-rays are completely safe for pregnant patients. Utilizing some of the tips that he recommended, things like that. We also use a lead apron in the dental office for all patients. We can utilize it for pregnant patients. We can double apron them if necessary, if they're like really concerned. So we put a lead apron, which, protects all of us from the radiation, but especially pregnant women, and then put a second one on the babies, where the mother is carrying the baby. And again, they're digital x-rays now. We're not, in California state law, there shouldn't be any, there are so few offices out there still, I know, that are using traditional x-rays, but most of them, say 90 to 95% are utilizing digital x-rays, which you have more radiation coming out of your cell phone than a dental x-ray. So, and they can also limit the number of x-rays they take. They can take it just in a certain site. They don't have to take a full mouth, especially if that patient is experiencing something. So just wanted to add that there quickly.
Thank you, Nandita, for adding that. And, definitely with you having that clinical experience, you're able to provide that additional insight. Really appreciate it. And wanted to mention also this particular printout here. This is a great little cheat sheet to be able to provide some tips for your clients that you're visiting with. Just on all of the basic oral health habits, such as the proper brushing technique, the amounts of toothpaste that we discussed, tips for new parents, and good oral health throughout the years. Like I mentioned earlier, you can see here how there's information provided during all of the stages of life to be able to maintain good oral health. And again, just maintaining those good oral health habits that'll keep your families with healthy mouths. Next slide, please. Also, the previous slide is from from Smile, California, and one of the biggest things is making sure that your clients are able to have a dental home, and also, that once the baby is born, that baby has a dental home early on. So also through smilecalifornia.org, there's a Find a Dentist tool, and there's also a referral list that we have available to share with your organization as well, to educate your clients on the different dental clinics that are available throughout LA County. These are low-cost clinics. They accept Medi-Cal, and this is a list that we go through regularly to make sure that it's up to date. So this is a resource that we can share with you as well. So with that, we've reached the end of our presentation, and at this time, I'd like to hand it back to Martha to do the Mentimeter, the post-test Mentimeter. And along with that, in the meantime, if there's any questions that we can help to answer, we'd be more than happy to.
All right, great. Thank you so much. And we'll give everybody a second to give you a virtual round of applause. So thank you both for this great presentation. As Nandita and Camilo mentioned, if you have questions as we're going through the post-test, go ahead and put those in the chat, and then we'll go through the Mentimeter post-test questions and circle back to all of the Q&A questions at that point. So give me a second to get the post-test up. Okay. Post-test. And then these are going to be the same. Oh yeah, go ahead.
Go ahead. You're good. We're good. I'll just wait.
All right, so I'm looking at how many we have at them now. Okay. So we'll see. Okay, so you'll see these are similar questions to what we asked before. So now we'll see if there's been any change after watching the presentation. So when you think about the health topics that you're going to share with your families, how likely now that you've heard this presentation is it that you will bring up oral health with your families? Code for this one has changed, so it's the same menti.com, but it's 2975 6517. So when you log back in, you'll need that new code. Thank you, Vanessa. Great. Okay, I am going to go to the next question, but it looks like we're pretty likely to bring this up now, which is great. I know we all have there's a lot of topics to bring up in our home visits, but it's great to see that people are likely to bring it up. All right, next question. How important is it to care for your teeth when you think about health priorities now that we have watched this presentation? I think I've accidentally closed the voting. Sorry, everybody. Now you should be able to vote.
It's still closed.
Is it still closed? Okay. Let's see if that works. You may have to refresh the page too. If you just hit that little refresh circle, it should work better for you. Sorry about that. Okay, moving on to the next one. Very important, so that's great. How easily now, after watching this, can you access the proper materials to educate families about oral health? Great. Okay, you guys made it nice and easy for everybody to find those resources. Thank you for that. And we'll make it even easier when this is over. We'll put all those on the blog as well and send that out to everybody so they're in one spot for reference. All right, moving on. How important is oral health during a pregnancy? Great. Okay. And how confident are you in showing your families how to care for their new baby's teeth after watching this? Great. I think this was one that was closer to like the middle range when we started. So that's great to see that people feel more confident. I think Nandita and Camilo gave some really great strategies and examples. So I'm happy to see that people feel confident. That's awesome. All right, I'm going to take this down and I'll pass it back to the two of you for Q&A. We'll see if we got any more in the chat. I think the main one here that I saw that wasn't addressed yet was about Oragel. So there was a question about whether Oragel was safe for a baby to use.
Thanks, Martha. And thank you everybody for filling out the post-test. So Oragel, we tried to avoid utilizing something like Oragel. Realistically, Oragel, even for us as adults, it's just symptomatic relief. It's an analgesic effect, usually goes away in about 30 seconds or 40 seconds. And so, for babies, I don't recommend, as a dental hygienist, I wouldn't recommend it to my patients. There also is, typically is benzocaine, the material that Camilo had mentioned. And there's like adverse effects. There's all these new studies that are coming out, all these adverse effects with benzocaine and other ailments in the bodies, especially with babies. I think for adults, it's probably still okay. I still, recommend just rinsing with warm salt water, utilizing a chlorhexidine rinse, even for adults. Some adults still use it though, just because they like that analgesic effect. So for adults, I don't think it's really an issue. But for babies, it's something I would try to avoid. If the mother, is absolutely, dead set on utilizing it, a very, very small amount will go a long way. But some of the other, and I think this is more geared to the teething question, but there's other things that can be done, at home things that can be done that are much safer and easier, cheaper. Also, Oral is actually pretty expensive when you go and get it at CVS or over the counter anywhere, basically. But yeah, there's other options with the teething rings, a cold teething ring, not something that's super frozen. Even, what I've seen is burp rags are very heavily used in that stage when babies are teething, and just putting it, if you don't even have to buy a teething ring, you can just drench that burp cloth in water and freeze it for just a little bit, or refrigerate it for just a little bit. And that's, that's enough kind of to soothe the gums of the teething baby. So if we can avoid oral gel, I would recommend that. And then I think there was a question about emergency and pregnancy Medi-Cal, and the answer is correct. I think somebody answered it in the chat as well. As it is, benefits are extended for a full year, especially with what's going on currently. So, we really urge, I know with restricted Medi-Cal, it's a little different. It's really for emergency services only. But there are ways, like Camilo mentioned, with the claims and things like that, that they can get that service. For full scope Medi-Cal, I know that the pregnant patients are covered throughout their whole pregnancy and 60 days postpartum. Fully covered.
And the 1 year time frame is actually coming into effect on April 1st of this year.
Oh,
yeah.
I didn't know that. There you go. So we have a question here. Not sure if I heard how coffee affects oral health, especially in pregnant women. Is it the same as soda? So I know there's different schools of thought on caffeine in, during pregnancy. I have a daughter that just turned 1 year old last week, and I drank a cup of coffee every day during my pregnancy. You did not want to see me, a pregnant woman, especially in my 3rd trimester, without coffee. So, I know there's different recommendations on that in terms of oral health. Yes, coffee is acidic, and so are sodas. We want to limit the intake. If we are having a cup of coffee in the morning, we want to do it in one time frame. So the frequency is important with any beverage that's a sometimes beverage, if you will, whether it's soda, coffee, sugary drinks, things like that. Use the frequency and not like sipping on it throughout the whole day is better, because every time you reintroduce, an acid into your mouth has to restabilize itself, right? So then that it's like that impact. You're constantly just washing it with acid. So, throughout the whole day versus just in an hour. So if we are, if the recommendation is it's okay to have a cup of coffee in a day for a patient, then we just want to do it on the oral health side, just in one setting or in serving, if that makes sense. Same as sodas. And then I think I answered the question about the homeopathic remedies for teething, mentioning about the burp cloth and, freezing that, utilizing teething rings. Does that answer that question? I think it was Scarlett that asked that.
Hi, Nandita. It's more of like the little pearls. I don't know. I don't remember exactly the name, but it's like teething pellets.
Let's see. Let me, I haven't seen those and I'm not super familiar. So it's something that I may have to get back to you on, but let me look it up really quick just to get an idea. While I do that, is there any other questions?
No, just that. Thank you.
Yeah, that's not one I've heard of before either. Sorry about that. We'll have to
that.
look that up and get back to you.
Oh, it's like a tooth necklace. Like they wear and then they just chew on it. Is that what for teething? Is that what it is?
No, it's more like it's like a little pill that you would use to like alleviate the teething pain. So like, for example, like chamomile is one, I believe, or like you would use
Humphreys
like,
tablets, I believe it is.
yes, tablets. And there's another one called Camellia. Families would find it at Target, to help with teething. So I just wanted to see how secure that is, from your
Able to
perspective.
find it. So basically, it just depends on the active ingredient. If it's all natural, typically it's okay. I've never used this before. I've never actually seen this before. But this is a great alternative. Actually, I'm just looking right now at the active ingredients and things. Maybe the compounds plant-based. Yeah, this would be a great alternative to actually Oragel. So I'm actually learning something new today on this call, which is great. So yeah, I don't see anything in the active ingredient. It's alcohol-free, because I know there's sometimes different schools of thought on the medications given. Some of the cold medicines have alcohol in them. So there's no benzocaine, there's no lactose, no sugar, no flavors, no artificial. So yeah, I think this is actually a really great, I have never seen it before, but from what I can tell just on the surface, if I find some other, I will do a little more research, and if I find anything else, I will send it out to Martha, contrary to what I'm looking at on the face value. But in terms of the active ingredients, I think this is great. It's a great alternative actually to Oragel.
Awesome.
Hey, Nandita, sorry to interrupt you, Scarlett, but I found a recent FDA notification on a particular ingredient called belladonna. And apparently this is one of the ingredients contained in one of the Highlands tablets. So this active ingredient can be potentially toxic to the baby, and the FDA has recommended, discontinue using of any product that's teething tablets that has that particular ingredient. So something.
Well, let me get back to you then. Let me just research a little bit more since I haven't seen it. I initially off of face value for the one, I looked at the Camellia one, and it seemed okay, but I do see the Highland brand as well, and I want to look up that ingredient. So I will get back to you, something I can follow up, Martha, on that.
Awesome. Thank you so much.
Of course. Thank you, Camilo, for that. I was probably going to find that out in the next hour or so when I did the research, but
I just put the link in the chat for everyone in case you're curious.
Great.
Great. And there's one more then, and we'll put that answer somewhere when I send the recording and the slides, we'll make sure we answer that in the email too, so that you're able to see what our research uncovers. One more question, it looks like, what recommendations can we provide parents on safety of full sedations for infants and toddlers with regards to teething treatment?
Sure, what the question is, a full sedation in terms of treatment? I'm a little uncertain what the question is.
Yeah, Alba, do you mind unmuting yourself? And
yes, can you hear me?
Yes.
Okay, so like parents who know that their children have like cavities and they're just fearful because they're recommending, since their babies are younger, or maybe 1, 2, and they need treatment, like they're recommending either full sedation, like putting the baby to sleep so they can do the treatment. I guess that's a lot of the hesitations with parents is how safe is that, to fully put their baby to sleep or their toddler so they can receive treatment.
Sure. Did you want me to answer this, Camilo? Yes. Okay. So
yeah, definitely. That's
it's all clinical. It's a lot of the clinical questions. So I'm just like I miss my clinical life. I have to be honest. I'm working in public health now. I don't see patients anymore. So these are all questions we used to get in the clinic. But a short answer to your question is yes, it's absolutely safe. Usually they're doing, it's not like a full sedation like in a hospital setting. There are times for special needs patients, for example, children that are special needs, that it's done in a hospital setting. It's like full sedation with an anesthesiologist. That's a little different than I think kind of what you're asking. And yes, there are risks obviously to be fully sedated in a hospital setting, but typically the sedations that are done in a dental setting for children and even for adults, like for adults, a lot of times the sedation is being done for like oral surgery. If our teenagers are getting their wisdom teeth pulled out, they need to be sedated, which I always recommend because you don't want to hear what's happening when the teeth are being pulled for our teenagers or a young adults. And that kind of sedation is called IV sedation. So it's not like, you're not being intubated, that the teenager or child is not being intubated. And it's very similar for pediatric sedation as well. Typically they're given like something to drink. It's like an oral suspension usually. Sometimes they do have to do IV sedation, but there's different, like clinically, there are different, there's like a scale of sedation. How, are they like in a what's called the twilight state with nitrous oxide? With oral suspension, it's a little bit more. And then with IV sedation, it's a little bit more. And then you have full anesthesia, which is something in a hospital setting. So I would encourage, it is fully safe. Now, in terms of trying to avoid getting to that point, trying other things. So one thing I mentioned was nitrous oxide. And so that's like the laughing gas that, if you guys are familiar, and that sometimes can help that child just relax. It just really, I had patients that would just laugh and laugh and laugh on the laughing gas. It's like actually a laughing gas. And so and very, very phobic patients, usually male, very phobic patients that would come in, adult males that would come in, and they would be totally fine under the nitrous oxide. So that's something, to advocate, because of course, it's scary to go, any type of sedation is scary. So if we can find other alternatives, we also and educate on the other alternatives. So mothers and parents, caregivers can ask for those things, especially when finances and billing and stuff is involved, because of course, more sedation, the more money the office gets. And so really pushing for those things and just trying it to see if it works first is another recommendation outside of answering the question of whether it's safe or not. So it is safe. I don't typically recommend having to, there's something called a papoose where they like tie the child down, to keep them not moving during a dental procedure. Sometimes it's necessary when they're on the nitrous oxide because they're like loopy and they're like, but they won't really know what's happening if they need to kind of be held down a little bit. So yes, it's safe. There are other options. Like I mentioned, the nitrous oxide, the oral suspension, if that's something you can, tell them, the parents that you're working with to advocate for themselves for as well. And then, and sometimes the sedation is necessary. You want the treatment to be done, and you don't want that patient the child to be phobic, right? Every time they come to a dentist, they're doing like 12 different things on them. So if the child is just not cooperative, then, sedation is the way to go, because they won't remember anything, right? They'll have a better experience. And that phobia, because that phobia, believe me, it comes all the way to the adulthood. I've had, 50 and 60-year-old patients that had some type of childhood trauma at the dental office, and it never left. We want to eliminate that if possible, while also, maximize our other options.
Okay, thank you.
There's another question. Some parents have mentioned they freeze their breast milk in ice cube tray and give their babies for teething in a food net like a pacifier. Yeah, this is a great, I did this myself. So this is a very, very good option also. You can, freeze the breast milk and utilize it as a teething tool. You want to probably put it like in a pacifier, or like they have these pacifiers where you can like put chopped strawberries or breast milk or anything iced. And that's also a good way to get some breast milk into them, and also some nutrition into them, and also help alleviate any of the teething issues that are there. There are a lot of antibodies in breast milk. So there's like some schools of thought that maybe that's like even more the most beneficial thing for teething. Not really confirmed, but seems plausible. Breast milk is pretty amazing. So any other questions?
I think you got all of them.
Great. Go ahead, Maria.
For ESPA 1, we're very limited in locations. I was wondering if you have like a list, like with like a specific locations, because like I mentioned, I recommend them to a couple of places in the AB, but I do get answers that they get the business either like way months ahead already. And what we need to do is like to prevent, like whatever is happening already, but due to locations limited in the area, I was wondering, is there any other places that we can recommend if you have a list or something like that? That would be awesome.
We do have a list available, and you're absolutely right. Locations are limited in the Antelope Valley, unfortunately, just due to the rural nature of that area. However, we will provide you with the list that we have available here. I'll be sure to share that with you, Martha, if we haven't done so already, so that way it can be available for everyone.
Thank you so much.
Great. Thank you again to Nandita and Camilo for this excellent webinar. This is so interesting and informative. And I know we have a lot of resources to share with everyone. So we will put all of those on the blog with the recording and the slides so that you can go back and reference all of those moving forward anytime you need them, and you can share them widely with everybody else. So I will give one more big round of applause to our speakers. Thank you so much for being here. This is great. We really appreciate your time and all the information. Thank you.
Thank you, Martha, for working with us, making this happen. Appreciate it. And
You're
then
welcome.
you know what I'll do is I'll leave my since we didn't get to the slide with my our information on there, I'll leave my email in the chat. I will also follow up regarding the the Highland and the teething treatment recommendation, that the pills. I'll follow up also on that as well. But thank you guys so much for your time.
Great, thank you. Yeah, good reminder. There is a slide with both of Nandita and Camilo's email, so that will be on the blog with the slides if you're looking for those. Thanks, everybody. Have a great rest of your day and your week, and we'll talk to you all soon. Thanks so much.
You guys, bye-bye.
Thank you. Take care,
Thanks
everybody.
again, Nandita. Thank you, Camilo.